we're in a space where you can probably attest to this, that organizations sometimes fall behind when we get to technology.
Hmm.
And now the buzzword is AI, and everyone's like, how do we incorporate it within our organization? Because we know that it's here. If people think it's not here, they're crazy. It's been here for a
Hmm.
very long time. But there is some things that really help us at a level of admin, of repetitive tasks that allows us to get something done, like plug in AI to do that,
Hmm.
where we can do more of what we love. Are you an organization that is really implementing this? Are you guys like dipping your toe in it? Where do you guys fall as an organization with AI and technology?
Yeah, I would say that we dip our toe in it. For repetitive tasks, we certainly use AI to help. I mean, obviously, it would be silly for a nonprofit who's focused on efficient use of the dollars to not take advantage of things that, especially repetitive tasks that would help in productivity for our staff. So there's administrative stuff that we certainly use it for. I'm sure, like many organizations, meeting notes, things like that, right? That's saving our staff time. But what I will say is that because we have a call center and we're dealing with patients that are often coming to us, in not the greatest state in their life, right? We would never implement AI to replace a human, right? That human interaction and our patient interaction is so important to us. But we certainly will implement solutions and are looking at solutions that help our agents be more effective on that call, right? So getting the patient faster information, more concise information, so they don't have to call multiple times, right? We're meeting all their needs in one phone call. So those are areas where we're exploring. I am a technology fiend. That's my, you know, kind of side hobby. While I was pregnant, I got my Salesforce administration certification just for fun. um,
That's what you were doing, huh? When you were just at home, just hanging out,
yeah,
just
just
for
hanging
fun.
out, trying to keep myself occupied. So I do see the value in healthcare, but it's balance, right? Especially when you're talking about um, patients and different demographics and how they respond to technology. There's so much goes into the decisions when you're looking at solutions like that.
That's good. I love the way that you said, how do we help our call center and those reps be more faster and accurate with the information? I think that's totally key because people, especially now, I feel like everyone, I used to say the Amazon effect, and now everyone's on the chat GPT effect.
Hmm.
Like they want information quick, right? We got to be that for them. That's just the time of life that we're on.
Right.
But I love that idea of how can we implement AI really, because to me, AI, I don't think ever replaces a person,
No.
but it makes our job a little easier. It's that tool in our toolbox that allows us to just be better at what we do and show up better. I
Right.
mean, it's happening in the healthcare now where doctors are showing up better and they can have one-on-one conversations without having to write all these notes, right? So
Right.
that's actually a good thing that's happening in the healthcare space, I would say,
Yeah, 100%.
right? The
I mean,
experience is different.
we live in a world where I feel like we put so much pressure on ourselves to need to know everything. At at, just at the tip of our tongue, right? And so it would be silly for me to say, "Oh, our agents, or expect our agents to know things about the hundred, close to 100 disease states that we support. I mean, that would be incredibly difficult for them to do. So, yes, certainly giving them the tools to access that information quickly and accurately.
This has been a really good conversation. But if someone's listening right now as we start wrapping it up and they've never heard of tafcares.org, what is that one thing you want them to know or do after this episode?
Tell somebody who's in need, right? So if you're, be the messenger. So I said you don't know us until you need to know us. Well, tell somebody, right? Spread the word. If you or someone you know is living with a life-changing disease, or you're having trouble affording your out-of-pocket treatment, we may be able to help. Visit our website. Our work resonates with you, we certainly always would encourage you to support us, by making a donation. Um, and 94 cents of every dollar donated goes directly to our patients and offering patient assistance. So I would say visit our website, tafcares.org, and there's a full list of our disease programs and information on how to apply, as well as information on how to donate, so we can help more people in need.
That's what I'm talking about. We got to get the resources out there.
Yes.
I ask you, after building a values led career, is there any quiet wins that remind you I'm exactly where I need to be? I know there's plenty of them, but what's the first one that comes to mind?
Gosh.
Got to
I
put you in
mean,
that. This is not even the blind question yet. This is a good question though.
uh, that it doesn't feel like work, I guess. That
Okay.
my dad would always say to me when I was young, when you're doing something you love, it never feels like work. So I don't feel like this doesn't feel like work. So maybe that would be the sign that I'm right where I'm supposed to be.
No, that's true. That is true. If
Yeah,
it doesn't feel like work and you just wake up happy every day,
yeah,
like how cool is it to say, I love what I do?
yeah,
Um,
and courage. I think that through this journey, my leadership journey, and figuring out what I wanted to do as I grew up, courage. I always had courage. So whenever people ask me as a leader, what would what advice would you give, or just always have courage. Fail, reflect, get back up. Because
got to.
you just never
Yeah.
know whose life you're going to change, that day. And if I didn't have
Hmm.
courage, I wouldn't be where I am today helping, you know, we helped over 40,000 patients last year, right? So,
That's amazing.
yeah.
And as you mentioned, just showing up truly makes a
Hmm.
difference. Sometimes people are afraid to show up. Just
Right.
show up authentically you, and you'll realize the rooms you're actually able to inspire by
Hmm.
just being you, by sharing that knowledge, by having that courage, being confident
Right.
in yourself. No, I love it. I love all those. As we're talking to leaders, especially in the I'm in the high school. I think I told you I lead the nonprofit in. You said you're in Orlando, right?
Yes. Hmm.
You know Edgewater High School.
Oh, yeah, yeah.
So I'm the president of Edgewater High School,
Oh,
and
nice.
to be at that school and just speak to these young kids and letting them know the nonprofit space exists, because I feel like it's something we don't talk about often. People
Hmm.
go and right, they chase that paycheck, but it's like, when do we tell kids to chase purpose?
Right.
Because to me, is when you chase purpose, the money would follow anyway.
Right.
But to have this thing that you can say, oh my God, I love what I do.
Yeah.
You could do 50, 60, 70 hours and it just never feels like work, because you're just kind of almost getting your fix in a sense, right?
Hmm.
How good does it feel that I go home and I change all these lives?
Yeah. I mean,
You know?
it's an incredible feeling, and I'm sometimes you're in the day to day and you forget, right? And then I attend these patient conferences, and they come up to me and they tell me their story, and I'm like, oh gosh, like like you said, you cry when you hear somebody else
Yeah.
cry, or you hear a story that's me. It's like, oh, it feels so good to be here, and somebody's benefiting from this. So